We've said that we support having a multi-year evaluation of lean and the benefits that we see in the healthcare system, and an ongoing analysis of lean in Saskatchewan's healthcare system. So the research that's been done is just kind of the phase one part of it. So there's some things that we take from this report, not unlike what we would have heard, both positives and some of the negatives over the last number of years. So we've made adjustments since the report would have been finished in 2014, both responding to the report, but also things that we would have heard outside of the report. I believe Health Quality Council budgeted about $235,000 and it came in just under $200,000. So it was about $35,000 under what they had budgeted for. We wanted to evaluate the information that was in the report, and the researchers since then have decided to apply for CIHR federal grant funding to do a multi-year evaluation based on the baselines that have been established. And it was felt that making the report public would help their case for federal funding. Because a lot of it is just based on some anecdotal work. I just think some of the comments that people made in terms of, in the one case somebody said, this is the best hope that we have of transforming the healthcare system, knowing how complex and how expensive, and that's a very hopeful statement for me. In terms of the efficiencies or the savings that we've found in the healthcare system, so right now we're well over $130 million. That number won't necessarily be reflected in this report. My worry would be is people would point to this report and say, well, see, the government's numbers not right. I think with anything, it's, people are going to take what they want to take out of this type of report. I think the more important is going to be the multi-year evaluation, and that work wouldn't be really possible without this initial work, the phase one work.